Hi everyone, my name is Tiffany Zhang, and I'm the founder and host of Undocumented History and Online YouTube video podcast. Welcome to episode 14. Since the Asian American community is so diverse, problems arise when lumping them into a single category when collecting health data, as it hides problems experienced by minorities within the Asian American community. However, Dr. Chu, our interviewee for this episode, is helping to change that. One of her studies that Dr. Chu has conducted as the director of ADAPT in partnership with Boston's Chinatown is studying the effect that heat has had on its residents. She found that Boston Chinatown is one of the hottest neighborhoods, which may lead to heat hazards and other health problems. But more on that later in this interview. In this interview, Dr. Chu and I will discuss the environmental disparities that Asian Americans may face, barriers that may prevent Asian Americans from seeking mental health help, and the relationship between acculturation and mental health. Here is my conversation with her. Hi, everyone, and welcome to Undocumented History, an online video podcast focused on educating others about Asian culture and history while also amplifying Asian voices and stories. I'm Tiffany Zhang, your host, and today we have a very special guest, Dr. Chu. Dr. Chu is the assistant professor at Tufts University in the Department of Medicine and is the director of ADAPT, which stands for Addressing Disparities in Asian Populations Through Translational Research, a community academic partnership with Boston's Chinatown. Dr. Chu, thank you so much for being here today and taking the time to join me. Before we start, is there anything else that you want to add regarding to what you do and who you are?
I'm just really honored to be here. So thanks, Tiffany.
Of course. So, kind of to establish some background, what sparked your interest in health and the environment?
Yeah, great question. So let me think way back when. I think my first introduction to applied public health was through my dad, Dr. MyDzung Chu. He was a public health outreach worker for TB patients in the greater Springfield area of Massachusetts. And so I would go on visits with him. He was also a community leader. So he would do nutrition and education screening. So I think he always encapsulated to me the idea of public health in a community setting. And then I became interested in environmental health through various engagement in my Vietnamese community in Springfield. So my sister had done research around green nail salons in the Vietnamese community, and I helped to volunteer with that um, while studying my undergrad at Smith College. I was a neuroscience major, and I had to do a seminar paper on risk factors of Parkinson's disease and causes. And so digging into the literature, I found that there were a lot of information linking pesticide exposure in utero and its impact across the life course, and as well as incidence of neurodegenerative disorders like Parkinson's. And those that are more likely to be exposed to pesticides are, low income, migrant workers, immigrants, limited English speaking residents. And so that was an introduction, that and my experience in my own community around nail salon workers and chemical exposures in the workplace really introduced me to the operationalization of environmental justice in the Asian immigrant community. And so I've always gravitated to work that is community oriented and research wise interested in environmental justice, working with immigrant communities.
That's great to hear. So, I guess, obviously, this interest in environment led you to become the director of ADAPT, which, just to reiterate, is a community academic partnership with Boston's Chinatown. What are some goals that ADAPT hopes to achieve, and what are some projects that ADAPT is currently working on?
Good, thanks. It was a long road up until, from when I started public health to where I am at ADAPT, but fast forward to where I am now at Tufts. So first, I'll give you a little bit of background about ADAPT, and thanks for the introduction of our acronym. So we are a community academic coalition that started in 2011 through the Tufts Clinical Translational Science Institute in Boston. And so our mission is to be a coalition of community and academic partners committed to advancing the health, well-being, and the visibility of underserved Asian American communities, and really emphasize the visibility. Oftentimes, especially in research, with the data being aggregated, is oftentimes difficult to see the health inequities impacting the Asian immigrant communities. And so our DAP is our goal is to pursue community engaged research as well as education advocacy that really translates into improved health service delivery policies or health equity. So research for action. And so some of our examples of our collaborative projects can be found on our website. But some of our initiatives this year, we just finished our strategic planning process for 2023 to 2027. And so our first year is to really operationalize that and think about ways in which the work that we have done collectively between academic, clinicians, community partners could have more translational impact, disseminating our research findings, and then trying to think about being present in policy decisions, like building our visibility and disseminating our research to policymakers, to community advocacy groups that could use that data that we found to improve community health. And so we have 2 work groups that we've started this year focused on increasing mental health access as well as data equity. So Massachusetts just passed its data equity bill that mandates state agencies collecting demographic information to further mandate them collect ethnicity information, so country of origin, that has huge impacts and is a win for not only our Asian American community, but other racial ethnic communities that have a large proportion of immigrant residents, like the Caribbean community, the African community. And so that data equity work group will help to follow and track that bill and its operationalization and ensure that clinicians, researchers, community groups are able to access disaggregated data, as well as think about the intersection of ethnicity with other important social determinants like class, education, et cetera, et cetera.
Mhm. Yeah, I love the focus on health and ethnic and racial minorities, and I love the way that ADAPT is promoting like research through action or action through research. I can't remember, but um, I know one of the projects that ADAPT is doing based on prior research is that ADAPT is, or you're currently researching the hot temperatures of Boston Chinatown and its impact on the health of Asian Americans living there. What are some of your findings so far for that project?
Yeah, so thanks for mentioning that project. So just a little background with the Chinatown HERO study, HERO standing for Heat Equity and Resilience in Open Space Study. So it's a pilot study that's funded by the New York University Center for Environmental Health Translation. And it's working with community partners, such as the Asian Community Development Corps, as well as our artist and landscape architect, Panapa Prakamol, and Dr. John Duran at the Tufts Engineering School, as well as several other community partners to look at, to measure air pollution for the fine particulate matter, as well as heat stress indicators, such as the wet bulb globe temperature, across open spaces in Chinatown. So based on existing data, we know that other studies, as well as the city of Boston, have conducted in the last 10 years. Unfortunately, we know that Chinatown is an urban heat island, so it has the largest density of impervious surfaces like concrete and asphalt. Also, the lack of open and green spaces in Chinatown compared to other neighborhoods that all contribute to it being the hottest neighborhood in all of Boston, as well as the highest ultrafine particles, particulate, as well as air pollution because of its the artery, so the 90 east-west, as well as the 93 north-south highway, really bisects and has intersected the Chinatown community and contributed to a lot of the air pollution hazards. And so our study, given that background context and the history that community groups have led to really fight for better and healthier communities in open space, our community partners at Asian Community Development Corporation, sorry, they said that disaggregated data in open space could be helpful to contribute to the work that they were already doing. And so we set up purple air monitors and Kestrel monitors around the neighborhood. And what we found so far is that, if you were an individual just walking around Chinatown across these 12 different open space sites that we collected data from, you could tell that there's differences in the type of concrete and pavements, its proximity to heavy road traffic, the types of trees, the lack of trees, how hot it feels, the level of shade. So you could see the disparities in like the urban design infrastructure. And so our hypothesis was that even though it's a very small neighborhood within 1 mile radius of each other, that these urban differences in urban characteristic will contribute to differences in heat and air pollution level. So what we found in the data so far, and we still have to kind of finalize and analyze the data, but preliminary findings indicate that the levels of air pollution and heat were actually quite similar across the 12 open spaces, despite differences in characteristic that could be protective, such as the level shading in trees and different types of porosity and the reflectance of the pavements. And so I think, again, like we have to look into the data more, but I think that has huge implications for what types of interventions and investments we want to advocate for to improve, improve the air quality as well as the temperature across Chinatown for residents.
Hmm. Yeah, that's great that you're doing that research. I feel like at least like I'm not like an environmental like health studies person, but I feel like health or heat isn't something that people focus on as much. It's more like other things. I feel like people kind of just see the heat as more normal, I guess, because it's like hot in some places, I guess. But yeah,
And
it's
where
really
you
great
are,
that
your temperature is right where you are is really high in the summer.
yeah, I feel like because I live in Texas, at least in my point of view, it's like more normalized to like the heat is more normalized, so I don't think about the effects of heat as much. So it's great that you're doing this research. And I would like to know, like, what are some other environmental disparities that I guess Asian Americans face?
Yeah, so it's, unfortunately, it's not as well known, but Asian American communities have faced a lot of environmental hazards that have been documented. So in the literature, much of the documentation of environmental health disparities have been focused on outdoor air pollution. So um, uh, national studies have found, as well as regional studies have found that areas with high proportion of Asian Americans have as high or higher levels of hazardous air pollutants, such as fine particulate matter, ultrafine, nitrogen dioxide, as well as cancer risk clusters compared to other racial ethnic minority groups. So several studies have shown that. In Boston, the block groups with the highest proportion of Asian Americans, specifically Chinese, have higher ultrafine particles. In Los Angeles, studies looking at census tract with a high proportion of Native Hawaiians and Pacific Islanders have found that they were in closer proximity to toxic waste sites, industrial air pollutants and freeways, high asthma rates among children with among Asian American communities with variability in ethnicity. There's also high lead levels that have been found across different Asian ethnic groups. So looking at, and then there's literature that I'm familiar with related to endocrine disruptors, metals, like I mentioned. So in the National Health and Nutrition Examining Survey, which is like the national survey assessing biomarker levels across a representative sample of U.S. population, several studies have found higher levels of cadmium among Asian Americans, arsenic, lead, I mentioned, compared to other racially minoritized groups. And so that really warrants further research. Other studies have found a high rate of non-smoking lung cancer rates among Asian women, that there might be a environmental component to that. And so, and then also occupational health studies have looked at disproportionate exposures among service workers, right? Thinking about the low income immigrants that come to the US. So from a lot of studies looking at nail salon ergonomic hazards to chemical exposures to chemical hazards in the dry cleaning industry. And so I think for me, it's really important to raise the visibility that I mentioned earlier about the disparities that are happening in our Asian American communities so that they're more included in the conversation around environmental justice, right? And so the inclusion is important because it leads to allocation of resources and funding for our communities. And thinking about, the tools and data collection systems that we currently have nationally, oftentimes the language used to survey folks is in English or Spanish. And we know that the Asian race comprise over 50 different ethnicities and languages. And so we need our country need better tools to do research and better community engagement of Asian ethnic groups and immigrants. Asian Americans are the fastest growing racial and immigrant group in the US now and for the next, projected to be the next 40 years. And so it's really, really important that we do better engagement outreach to really understand more the disparities issues, as well as community groups that are really mobilizing and trying to help improve and preserve their community.
hmm Yeah, going back to Boston's Chinatown, I think it's not only important to raise awareness about these things for the people that are living in Chinatown, but also the people that are visiting and go there often. Because I know, at least in my community, I live like near a Chinatown, and I know a lot of people who are not Asian still go and visit these Chinatowns. So I think that's obviously important. And also, I like the fact that you talked about environmental justice because I feel like that usually, when people say environmental justice, they usually mean like climate change and stuff. But I think it's also important to talk about environment and health as well as climate
Mhm.
change.
Definitely, yeah.
And then moving on, so I know we talked about like physical diseases, but I know in Adapt you also researched the mental health of Chinatown residents, and you found some barriers preventing some from access from mental health help. Can you talk about like the barriers that Asian Americans face from getting mental health help and how we can like overcome these barriers?
Yeah, definitely. And just a little context of um, the study for that that I mentioned was evaluating the mental health first aid, which is internationally recognized and utilized training for a layperson to be like first responders to help recognize the signs and symptoms of mental health distress. And so through a small pilot grant from the Tufts College Tisch sorry, Tisch College seed grant, and working with our two community partners, the Boston Chinatown Neighborhood Center, as well as Asian Women for Health. Through that pilot grant, we were able to train 4 community-based organization staff, so 2 from BCNC, 2 from Asian Women for Health, who then trained 41 community participants on the mental health first aid. And so through that process, we also held focus groups with the staff and volunteers of the organization, as well as the community participants taking the training. So it was 2 part. First, we, like what you alluded to, we assessed what are the mental health issues and barriers in the Asian American communities. And then the second part was evaluating the cultural responsiveness of the mental health first aid training. So to respond to your question, getting at the first part, nationally, mental health is a huge priority and for the Asian American community. So Asian Americans have one of the highest underutilization of mental health services, and it's compounded by various reasons, including a lot of lack of linguistically and culturally appropriate services for mental health, the lack of providers trained to work with these populations. Um, and I think the diagnostic tools and assessment that we have, such as the PHQ-9 or the generalized anxiety depression scale, haven't really been validated, implemented, or created in Asian American communities. And so I think oftentimes the way that the Western or the traditional way we approach mental health, there is a disconnect with folks in the Asian American community, especially immigrants and limited English speaking folks, of how they see health and how they see mental health. And so through a different project, it's really important to think about providing mental health care at the community level, not just in a clinical setting. And so some of the common barriers is, think about like the family and interpersonal stigma. A lot of um, community members that were part of our pilot project indicated that, in our community, there's a close-knit nature of the family unit. It's an intergenerational family unit. A lot of folks share concern that people might find out if they knew that they were going to see a mental health specialist. The stress and burden of the immigrant experience, also they share that oftentimes other burdens such as like housing, getting food on the table, getting kids into school, among the parent generation, all that stressors kind of don't allow room for individuals to kind of think about and reflect on its impact on their mental health, and not having that openness of dialogue among parents makes it difficult for children and the younger generation to also share and talk openly about mental health. And so Uh, some of our recommendations from our community partners and volunteers and staff of the community organization is like better strategies and tools to talk about mental health across generation, in a facilitated way. There's also it's also important to think about like structural barriers to accessing care. A lot of our community members mentioned the lack of insurance coverage for mental health, the financial cost of seeing a therapist, not having, especially in an intergenerational household, maybe not having room or space for privacy to, to talk to a therapist or seek out mental health. And then during COVID, there were a lot of issues that a lot of communities were affected, from a social isolation to loss of like safety nets and social networks. And I think also in addition to that, in the Asian American community, there were high rates of Asian hate crimes and discrimination. So lots of fear, to be able to like go out, go out in the community, go to grocery store. And so that fear, I think, contributes to, coupled with the lack of workforce and clinicians, coupled with, stigma, I think really creates like uh, you know, difficult, and a challenge and a lot of barriers to for individuals and families to seek mental health services in the community.
Mhm. Yeah, I think maybe like lack of understanding. I feel like there's a shortage of Asian representation in psychology, also in mental health services, which I also think helps perpetuate that kind of like not like closed-mindedness, but like hard like barriers to getting mental health access for Asians, which I really like that you talked about. And I know you talked about kind of like the cultural and immigrant stress. So can you talk a little bit about the relationship between acculturation and health?
Yeah. I think that's acculturation, I feel like is such a packed term and is we should like define it. And so I think several there's been a lot of literature trying to dissect what acculturation is, but I think broadly acculturation describes a process in which individuals adopt attitudes, values, customs, beliefs, and behaviors of another culture. And so it's like the process of immigrants coming to the US and across time. And oftentimes people think of acculturation as a unidimensional, so one directional process in which like the immigrant assimilate to the host culture norms and values and behaviors. But I think there's also literature showing that it could be multi-directional, that immigrants contribute a lot of their own culture and kind of create like a community, an enclave community, in which they live, in which there's more enculturation or more bidirectional sharing. Um, and so and I think the research that's out there and the findings out there are also limited to the tools that are used to measure acculturation. And so common proxies that are more one-dimensional approximation of acculturation is like looking at nativity status. So if you're immigrant, a US born, the duration of time in the US. So they look at length of time, also languages spoken, English language proficiency, based on the time in the US. And so those are like really crude measures and studies that have looked at that. And it's oftentimes based on secondary data analysis that you're limited to the variables that you have. And those are usually the most common variables. And so studies that have looked at those levels, proxies for acculturation have found, among Latinos, Latina immigrants, as well as Asian American immigrants, that um, recent immigrants. So some of the aspects is like that high levels of acculturation, so living longer in the US, have been associated with like higher rates of cancer and infant mortality, indicators of poor physical and mental health, and higher rates of obesity. So that's the idea is like the negative acculturation process, right? That have been um, shown in some of these health research is that the longer you are in the US, the more likely you are to adopt behaviors that are, as well as incur stress of living and potentially, in likely racial discrimination and all these barriers that we had just mentioned, not just to mental health care, but other access to housing and financial and food security. All those stressors contribute to poor health decline, in addition to like more sedentary behaviors and maybe lack of access to um, cultural types of foods and ways of being. And so there's a process of negative acculturation. But other studies have shown that with increasing time in the U.S., the opposite happened. That there's like better physical activity, reductions in other unhealthy behaviors. So it's really mixed. I can't give you like a kind of like a one direction or like a whole summary of like the literature being narrowed down to one line because I think the process is so different. I will recommend this paper by Dr. Alberto Lanza, and it's called Towards a Theory-Driven Model of Acculturation in Public Health. She published it in 2006 in the American Journal of Public Health, and it really calls upon us as public health practitioners and researchers to look at acculturation from not just a cultural and behavioral lens, but also a structural lens, right? Thinking about what are the resources and structural factors that influence how immigrants are able to successfully or challenges that they face in immigrating to the US. And what are some of the political factors, right? The push-pull factors, how they received in the geography that they reside in. And so I think there's more yet to be done, but it's definitely an area that I'm super, super interested in.
Hmm. Yeah, definitely. I think going back to what you said about how like acculturation, like there's it's not one dimensional. There's kind of a trade-off. Like you get affected by society, but also society affects you. I think it makes perfectly sense to me that there's like kind of a trade-off and stuff.
Mhm.
So yeah, thank you so much, Dr. Chu, for coming on and speaking with me. It was great listening to you speak. I really loved all your insights. And yeah, I guess like, do you have any closing statements that you want to say?
I think so. Thanks, Tiffany, for again inviting me here. I think there is so much more work that we can all do, whether we're in the science, the public health, the clinical, or the non-science field, to really amplify the issues and the needs and the concerns, as well as the power and the collectivism in the Asian American community. I think it's important and really championing data equity. Right, we need to have better data and to question the data that we see and the statistics that we see and champion bills that allow for a better understanding of the diversity of our Asian American community and advocate for better policies and regulation and research to really reflect the diversity in our community and really prioritize those that are underserved, right? Thinking about other social determinants of health, not just a race and ethnicity alone.
Of course. And yeah, so on that note, thank you so much, Dr. Chu, and I will see everyone next time. Bye.
Okay, take care and bye.